Hello, everyone, and welcome to today's session, How to Get Started, Your Path to Home Dialysis. My name is Ria Suarez, and I'll be guiding our conversation. Today, we'll cover your options, how to match treatment to your daily life, what support is available, and what the process looks like. The objectives for today's sessions are to provide an overview of home dialysis treatment options and discuss the benefits, challenges of each to help patients determine the best fit for their lifestyle and medical requirements. Identify available resources to guide patients through the home dialysis experience, from training to ongoing care. Understand the transition process from in-center to home dialysis and what to expect in the first 6 months. Our goal is for you to feel informed and confident about exploring home dialysis. And I am joined today by Dr. Mukul Gupta and Emmett Henderson III. Dr. Gupta is a nephrologist who works with patients to find the dialysis treatment that best fits their life. Emmett Henderson is an AKF ambassador who speaks around the country about kidney health. He will be sharing the patient perspective as someone who does dialysis. We will also have an audience Q&A portion at the end of this session, so please type your questions in the chat and we'll do our best to get to them. So we will start with an overview of home dialysis and the different options that are available. So Dr. Gupta, what exactly is home dialysis?
Thank you, American Kidney Fund, and everyone on the call for having us for this discussion. Home dialysis is basically that you do dialysis at home. There are two forms. One is peritoneal dialysis, and the second is home hemo or home hemodialysis that can be done at home.
Wonderful. And how often do patients have to conduct their treatments for each?
So for peritoneal dialysis, it's generally done in the night through a machine, or you can do it manually at home, which is done every day in the night. Home hemo, depending on patient's need and the clinical situation, it is done anywhere between 4 to 6 times a week. Home hemo also can be done in the day or in the nighttime, depending on patient's lifestyle and the choice.
And Emmett, could you describe what type you do?
Absolutely. I thank you for asking too. I definitely do the home hemodialysis. Doing it that way changed the game for me completely. I'm able to do it anytime, morning or day, what best fits my schedule. And I'm also able to travel. I wouldn't be able to do that at an in-center clinic.
Great. And Dr. Gupta, how does home hemo work?
So home hemo works is that you have a machine at home, and patient alone or a care partner, again, depending on the situation, they are trained by a nurse before they go home, and they do it at home with the machine. They get supplies delivered to their house. It requires a water source. So all those things are part of the training, which are done by the clinic. And you can do it in the day, in the morning, or in the evening. It is just how your schedule fits in dialysis.
Great. And can you do overnight treatments? Can you talk a little bit about what that looks like?
Yes. Home hemo can be done at night during sleep. And you can actually do it. Generally, it is said that you're not supposed to have somebody in the house when you are doing it at night. And but you can have somebody close by, and you do it in the sleep. You start the machine, you take your vitals, and you hook yourself up. Either you use a fistula, or which we will discuss further, or a catheter, and you sleep through it. You wake up, you take your vitals, you disconnect, and you go on with your life.
And Dr. Gupta, what are some of the biggest differences between peritoneal dialysis and home hemo?
So peritoneal dialysis, it's how the machine or the dialysis cleans your blood. That is the main two differences. The peritoneal dialysis is done through the abdomen. Your abdomen behaves like a kidney or dialysis machine. You hook up in the night, put in sugar water in your abdomen. That takes away the toxins, and you drain it in the morning. You can do it throughout the day too. Home hemo is done by directly accessing the blood, and the machine cleans up the toxins and returns the blood back to the body. Home PD is a small machine, almost size like of a suitcase, which you can keep it on nightstand. There is no access to blood. In home hemo, you do access the blood.
Great, thank you for providing that overview of the two types. So we're going to transition now to discuss how to match your treatment to your lifestyle. And before we begin, I would like to mention AKF's Home Dialysis Decision Guide. So this resource provides an overview of the process of starting home dialysis that can be helpful as you begin your home dialysis journey. So let's get started. Dr. Gupta, how does someone decide which option works best for them?
I think it's a decision between your care team and you, but it mainly depends on your lifestyle and how comfortable you are doing each of the therapies. And mainly, like, are you working? Do you have to take care of kids? Are you a caregiver? Or you want to travel like Emmett? Or you have other things to do? I think everybody should have an opportunity for home dialysis unless there are other indications or other situations that you cannot do it.
And Emmett, how does home dialysis fit with your work?
The way that it works for me is that when I did the in-center dialysis, I basically was doing it 3 days a week where I had to shift everything around my life for those 3 days a week, 4 to 5 hours a day. With home hemodialysis, I could do it at night or during the day, which makes me completely free, depending on my schedule. And then, of course, I can do dialysis at any time, especially when I'm traveling. For me, that's a passion because I travel around the country to speak, and I need that flexibility, and home hemodialysis offers that.
Wonderful, thank you, Emmett. What about space at home? Dr. Gupta, can you speak on this?
Yes. So as the space at home, you do need a dedicated space to store supplies. And generally, it could be even a hallway in your house if it is PD, because these are big, multiple number of boxes. And the machine generally is kept on bedside in PD in the night because you do it in the sleep. In home hemo, you do get a dialysis chair at home. It is patient's choice. Some patients want that chair. Some patients absolutely do not want that chair. They have their own setup. And then you have area for putting the supplies. And in home hemo, you do need a separate space where you dialyze. You generally don't want to move the machine and attachments every night. So that kind of confines a little bit that it's not easy to move, and it's not advisable to move and change the position every night.
Thank you. And Emmett, can you tell us a little bit about your home setup?
Yeah, absolutely. The way that I have it, you mean at home or in the center itself? I'm sorry.
At home.
Yeah, the way I have it is exactly how Dr. Gupta mentioned, that I have an area where my machine is and my recliner chair that I sit in. This is a picture of me at home doing the dialysis at the comfort of my home. You know, with my TV in front of me and all my activities and snacks, that's just the perfect way for me. And then doing home hemodialysis, I had to have a care partner, which in the next slide shows my fiance doing the training with me. And after she passed certain parts of being able to use the machine, stick me with the needles, uh, everything worked out well. And that's the day she graduated. And it definitely deserves some high fives on that. And then being able to travel that I mentioned, my next slide is a picture of my dialysis machine in my cruise cabin. So I've done a few cruises during my time of end-stage renal failure, and that perfectly fits because sometimes it's not all work. It has to be some play, and being home hemodialysis allowed that to happen for me.
Wonderful. Thank you, Emmett. Thank you for sharing those pictures with us as well.
Thank you.
So, Dr. Gupta, you mentioned unfairness in who gets offered home dialysis. Can you explain that a little bit more?
Yes. So in United States, a lot of patients do start dialysis, what we call unplanned, urgent, the different emergent terms for it. And if you see that most of the Black patients and Latino patients are in that category, and also research has shown that these patients overall don't get told about home dialysis. And additionally, anybody who's ever told about home dialysis, around 50 to 60% of those patients do end up choosing home dialysis. I think some of them also it could be that patients' language could be a barrier, that some of them need education in a simpler term, and also the language in which the education material is. All of the material in education is not in the same languages.
Great. Thank you, Dr. Gupta. And Emmett, did you want to speak to that as well?
Oh, absolutely. The way that I look at it being done, first of all, that there's a lot of people that don't even know home hemo even exists. I mean, I go into the hospital when the nurses ask me about it, they kind of tell me about, you have a nurse come in at home or you do it in center. I said, no, home hemo. So I have to explain to them, exactly my process of doing it. And then, and it's not for everybody. Not everybody can put the needles to their arms and stick themselves. But seeing other people doing home hemodialysis just opens the door to let other patients know what's possible. So it's something that I like to talk about and bring to their attention.
Great. Thank you, Emmett. Thank you, Dr. Gupta, for sharing those insights. So now that we've reviewed the different treatment options, let's explore the various types of resources that are available to patients. Dr. Gupta, what support can patients access?
So I think first thing starts with asking questions, and it starts before even you go on dialysis, a lot of education and support. So if you have within your family or in your friends asking questions about dialysis, one thing I always like to tell patients is that what did not work for your friend or family member may work for you. So everybody is different. And then after that is working with your team to get education even before you go on dialysis is this first step towards support. And most of the clinics do have now an education option that they can refer you to a specialized education, which generally has a broader overview, but asking about home dialysis and going and meeting the team, if you choose to do either PD or home hemo, is the next step. Because the training is pretty extensive and the nurse will never send you home if she's not confident. So, and training involves 4 to 8 weeks, and PD is a little shorter. It's up to 2 weeks. Home hemo can take anywhere between 4 to 8 weeks, depending on the access, depending on patient and partner's comfort. And you do it at your own pace. So finding a clinic, accessing these, there are a lot of online resources. National Kidney Fund Foundation has it. And asking, even if you're in center, asking your clinic to send you more information.
Right.
Great, thank you. And Dr. Gupta, what training is involved?
For peritoneal dialysis, if you are going to do it at night through the machine, the nurses will teach you what kind of fluid to identify, how long you are on, how to connect and disconnect using safe and sterile technique. And then they send you home. Most clinics have nurses going to patient's house just to make sure everything is set up. They help you order supplies. They help you, like if you don't have enough space, you can order supplies every 2 weeks. All that is figured out in the 2 weeks of training. And sometimes you can get dialysis while you are trained. That's called urgent start PD. Or you can just train and go start dialysis at home. For home hemo is a little different because you can start with a dialysis catheter or a fistula. It doesn't preclude any of those two. So if for some reason you're starting urgently on a catheter, you can still do home hemo. They dialyze you while you are training. So you are in the clinic, depending on your treatment, anywhere between 4 to 5 hours or even less or more. And they teach you how to connect, disconnect the access, how to take care of the alarms, how much fluid to remove, how it cleans the blood, how supplies are hooked up. In that whole journey, they also teach you how to order your supplies, what you need. So, and that's why it is generally 5 days a week and takes up to 8 weeks to train.
Okay, great. And so what happens after training?
So after training, every clinic has a different procedure. Where we work, we like to go in patient's house and so observe up to two treatments in their house. And then we help them with supplies too, like how to organize. And even sometimes you had patients ask nurses which part of their house we think they should dialyze if they have a bigger house. Then they also, then they come back and see the nurses and the doctor every month. And they also have access to remote patient monitoring. Basically, what means is all the dialysis treatment is going on a cloud. It's being stored, and nurses review them daily or every other day. So nurses are kind of having an oversight on the treatment. So it's not that you're in your house and you're done. There is a communication between the clinic and nurses always. And there's an on-call first number that the clinic has given them if they have issues to call.
Great. Thank you, Dr. Gupta. And Emmett, why are patients helping patients so important, especially during this process?
Definitely knowledge is power. And talking to other patients answers questions that sometimes my medical team couldn't answer. So there's all kind of things like how do you handle social events? How do you handle, public speaking? What do you do when you're tired? It's just real world stuff that we do every day. Other patients have differently than your medical team, as great as they are. They can pretty much help in a lot of different ways. But I honestly believe knowledge is power. Speaking from experience and not speaking from someone who hasn't gone through it makes a big difference.
Yeah, and I would like to add that I completely agree with Emmett that I always tell and that I have not been on dialysis, but I've taken care of a lot of patients. So connecting with someone who's gone through and makes it feel come home. And home dialysis is in your house, adjusting the lifestyle. And especially if you're doing nocturnal or if you have a partner, it helps the partner also put to ease if they talk to the other one and they feel that it can be done.
Right.
And Emmett, how did you find these connections?
For home hemo, it was actually offered to me at my clinic when I told them about my lifestyle and kind of giving them the sad face that you have to come in 3 days a week and 4 hours a day. I just knew that would be tough for me. So they had given me that offer, and I knew right away I had to jump on it.
Wonderful. Thank you for sharing that. So let's walk through the process of transitioning to home dialysis and peritoneal dialysis so that patients know what to expect. So understanding each step can help you feel more prepared and confident as you begin exploring treatment and support options. Dr. Gupta, what are the actual steps to get started?
Yeah, the first step is detailed discussion and evaluation by kidney doctors to discuss your medical history, your life goals, daily routine, support at home, no support at home. Both are an option. And determining what fits for you. I think the major part is what patient is comfortable and medical history. I mean, most patients have told me that peritoneal dialysis is easier because you're not accessing the blood, the equipment is smaller, but everybody cannot do peritoneal dialysis. There are limitations in terms of history of abdominal surgeries. If you have extensive surgeries or if you have any issues with the abdomen in the past, the abdomen does not work good as for dialysis because you've lost some part of membrane. So, and if you choose home hemo, then you can either use a dialysis catheter or a fistula, depending if the fistula is ready or not, what are the life goals. Once you have chosen that, then going to an education class, I truly believe seeing the equipment and talking to the trainer makes the patients feel more comfortable than just a virtual class. And once you see the machine and you talk to your team, I think most patients feel much more comfortable than doing a virtual class. Virtual class is a good first step, but seeing the equipment, how the house would look like, helps people make decisions. And then once is that, a lot of patients start rearranging their house, they start preparing with the fistula, and then start readjusting for like FMLA, finding a partner if they're going to do solo. We highly encourage people to have someone on call, and we have access to that person as a clinic. So arranging all those things is the step. And then, of course, when the time comes, transitioning to home hemo or PD is the next step.
Great, thank you. And then could you explain what an access is?
Yeah. So for PD, it's a silicone tube in simple terms that goes in your abdomen, and you connect and disconnect to a machine which has sugar, water, and some electrolytes, which is pumped in your belly in the night, and it drains on its own. It is so quiet that you don't even feel it. You shouldn't have the machine noise. Most people see through it. It sounds like intimidating when I'm saying it right now, but most people don't even notice it. And so catheter, the good thing about the PD catheter as compared to home hemodialysis catheter is you can go to swimming pools. It's a private pool. You can take a shower or a bath, not a bath, a shower. And for home hemo, you get a shunt placed in your arm, and it can be your own vessels or it could be a graft that for which you can access for dialysis through the needles. And then for catheter, it's a port that's put in your chest. It is higher risk of infection, but it does not preclude you from going on dialysis or home hemo specifically.
And does insurance cover this?
Yes, both Medicare and private insurance should cover home dialysis access placement even before you start dialysis. And generally, clinics have people to help you through it. If you're in a dialysis clinic, they have social workers, which are very good in helping you with these things.
Wonderful, thank you. And I would also like to highlight AKF's Health Insurance Premium Program, also known as HIP. And this is our financial assistance program that provides grants to eligible patients nationwide. So this program supports kidney patients in the United States, its territories, who are unable to afford their monthly health insurance premiums. So Dr. Gupta, what happens after insurance and paperwork is approved?
So it's almost like an admission to a clinic, and it requires a lot of paperwork, blood work. Once it's approved, clinic has made arrangements to start training for you. You have equipment. Once you're in certain part of the training, the equipment gets delivered to your house with supplies. Initially, your nurses help you order it, help you identify what you need, and the nurses may even go to your house to finish the training. Every clinic is different, but my clinic nurses go to patients' house, and patients do appreciate it. It really helps boost their confidence. And a couple of times we've had nurses go back even after a week when the training is finished, so that patients just feel more confident about it. And you also get a form that you track supplies, and you kind of blood draws, like blood work. Now you don't draw the blood, but you send your blood off. So all those things are part after the training and everything is done.
Thank you, Dr. Gupta. Emmett, what were the first few months like? Can you describe that for us?
Yeah, the first few months with me was, well, first of all, I was excited to do it for one. And then it was definitely a learning curve because of the things you had to learn in such a short period of time that I did not want to be in the clinic as long, and I kind of wanted to do it quick, but I realized it's a lot to learn. And once I knew that I was capable of learning the machine codes, learning the process of, being clean and sanitation and everything, I was ready to go. So I figured by about 3 months in, it was definitely an everyday routine like the back of my hand.
Great. Thanks, Emmett. Dr. Gupta, did you also want to speak to that?
Yes, I always tell people, give me 6 months. I have patience. I said, give me 6 months, and it is going to be a learning curve, adjustment curve. And even after 6 months, if you're not feeling it or you not think it's worth it, we can always go back. I have not had anyone go back unless something happens in home situations, and it starts making feeling a routine. Sometimes, if the partner has something, we do have to revisit the routine. But we have monthly labs. We also have the option of video calls. Nowadays, after COVID, which is one thing that's happened, is we've been using video conferencing a lot. So if you have a patient who's having an issue and we see that the vitals or clinic records from last treatment overnight were off, they can always call us. We can hop on a call and kind of check in with each other before sending the patient to the hospital. We also have cheat sheets. There's a manual. So we make cheat sheets. Patients make their own cheat sheets. We use them with their permission. And so there's a lot of help that's going on. And once, as Emmett said, it becomes a routine once you get hang of it.
Great, thank you. And Emmett, any advice for people who are just starting out?
Yeah, definitely take notes. Definitely understand what are the most common codes on the machine that comes up. Start understanding when it comes up, what causes them to come up. There's a lot of, just and track how you're feeling as well. During the dialysis process, sometimes you can get more of a fatigued and tired feeling during it. And if that's the case, then, you want to make sure you let your clinic know this is what you're going through. Not all of it's bad, actually, and you definitely got to be patient with yourself. Don't get kind of ahead of yourself when you think things are going good, because before you know it, something is happening that it's kind of out of your element. So you're learning something new. Take your time, be patient, just like anything else you study for, and you'll be all right. You'll be all right.
Thanks, Emmett. Dr. Gupta, any advice for people starting out?
Yes, speak up if something is not working with you, for you, or with you. We are here to help. We make it, home dialysis is creative. It's the personalized way of doing dialysis. So clinics will make sure they work it in for you as long as it's safe. And that's my first thing. Whenever I see a patient who starts home hemo, I'm like, we will make it work for you as long as it's safe. That's the goal. And I'm going to take this phrase from one of the nurses at Washington University, Lisa Kester. One of her patients calls it lifalysis. It's not dialysis, it's lifalysis. So let the life take over dialysis, not dialysis take over life.
I love that. Well, thank you both for sharing your experience and insights today. So we'll now open it up to the audience for the Q&A portion of our session. So a reminder to our audience, please type your questions into the chat box, and we will try to get to as many as we can today. So our first question here, what has been some of the causes or risks involved with at-home dialysis? I had a friend who had contracted an infection a couple of times and had to be hospitalized. Dr. Gupta?
So I think that is an uncommon occurrence as per the research data in recent. The training and the equipment has improved so much. And as a clinic, we continuously work on retraining and identify things if we feel this patient could be a high risk for infection, especially if they've had a hospitalization or something changes with them, especially in peritoneal dialysis, because they are doing it by themselves. And if the infection happens, generally it shouldn't happen. If it happens, it's not fatal. You can get treated and you can switch to a different modality once that happens. But if you are having questions and you feel that you're not doing something as a patient, then you can talk to your clinic. And that's where, as Emmett said, is keep asking questions, making notes, talk to your clinic and see what you can do better.
Great, thank you. And for Emmett, we have a question for you. Were you given the choice between PD and home hemo? And what made you decide on home hemo versus peritoneal dialysis?
Yeah, absolutely. Considering this is my second kidney failure, the first one I did, peritoneal, excuse me, and I wanted to jump in that right away in my second failure. Unfortunately, my peritoneal membrane had failed, is what they had told me, so that was not an access anymore. And then that's when I just started to discuss my lifestyle about not wanting to come into the clinic, and so they offered the home hemo. And for me, again, that was like I know I'm willing to learn this. I know I'm a smart person. I can do this. And I know that the way that they're going to train is going to make it easy for me. So this was the route I wanted to go.
Great, thanks, Emmett. And Dr. Gupta, what EGFR number or stage do you have to start thinking about dialysis?
So generally less than 30, you tend to, and some people can stay less than 30 for a long time, but less than 30, you should start the conversation about options. That's when you start the conversation. When you are close to 20 or when you're discussing about transplant and all those things is when you start thinking about access, placement, and with peritoneal dialysis, generally you can get the access placed, the catheter, almost a month before, sometimes even immediately. But it is recommended that you get it done at least 2 to 4 weeks before you start training for peritoneal dialysis.
Thank you, Dr. Gupta. And for Emmett, what can you say to other patients with chronic kidney disease to be more proactive with their self-care?
I'm sorry, Ray, can you say the question one more time?
Sure. What can you say to other patients with CKD to be more proactive with their self-care?
To be more proactive is, I think Dr. Gupta said it all. You just got to be pretty much contact with your doctor. When the doctors give you the information, they'll let you know where you're at. And being more proactive is just acting on it. And what can you do to improve your situation? What can you do on your behalf at home outside of the doctor's care and medication is being proactive on that for sure.
Great. Thanks, Emmett. And Dr. Gupta, we have a question here. I've heard mixed information about whether or not you can have pets while doing home dialysis. It looks like this person has a dog. Can you speak to whether or not this is considered safe and what precautions should be taken?
So when you are doing peritoneal dialysis, you tend to, because of the catheter, if the dog nips on it, you have a risk of infection. So if you secure your catheter well, then protect it, then it's okay. While you have the pet with you in the night, you do not want the pet in the room when you are connecting, or even if you are attached to it. And same thing for home hemo, that when you are doing the treatment and where the equipment is, you should not have the pet. So you can have a pet in your house, but you have to be very careful and conscious of the fact that where the pet is, and he or she should not be around the area where you're doing dialysis or your supplies are.
Thank you. And another question here, what should I do if the dialysis clinics near me do not offer home dialysis training? Any recommendations?
I will let Emmett answer that.
There's only one here in the city that I am in San Diego. So, maybe an option to travel to the nearest one for that training process, but that training could be a while. So it would be, another option could be a home hemo nurse coming to you. So you just have to find out what your resources around you can offer and go the best way from there.
So adding on, a lot of dialysis organizations like Fresenius, DaVita have online, you can look up. The other is Renal Network. Renal Network can provide you with resources, American Kidney Fund, National Kidney Foundation. All these organizations do have resources for you to look up the clinic. And definitely, as Emmett said, locally asking and using your web search may help you.
Great, thank you both. And we talked a little bit about this earlier on support. Can you talk a little bit more about what support is available after I start home dialysis, and who do I contact if I run into challenges with my equipment or treatment?
I can answer that. For me, my home hemodialysis is supported by my partner because it does take a two team to make sure that everything goes well. Especially if I am doing my dialysis, I tend to sleep. That she can know when my alarm is sounding off, and she understands the codes as well. So that really works out a lot for me. And then just kind of keeping forward on going with the same routine that I had mentioned earlier. Once it becomes a routine, it's that support that I know is there for me. It's just everything. It's just everything. So I definitely recommend to have that for sure.
Yeah. And another question here, is it possible to do solo training for home dialysis?
Yes, solo can be done, and a lot of people, not a lot, but people do it in United States. And there is mechanisms that you can add on to, like Emmett showed his equipment. You can have devices that can shut off the machine if there's a needle dislodgement. Um, in our clinic, what we do is we have patients on solo. We have them certain other precautions and treatments like blood flow rates and how much fluid they're taking off. Those things are done on a precaution. What we've done also is that initially they may call the clinic or through the secure thing and say that I'm going on treatment. So we know initially when they start, the patient is doing the treatment at home. We review the records more closely in the initial 6 months. We look at the access more closely. We also tell them to leave the door unlocked when they go on treatment and have someone on call. So in case something happens, the person can quickly enter their house, or they have house keys. And if they're not feeling well, they do not need to start the treatment and they need to call the clinic. We're a little extra protective about those things. We put these things in place in our clinic so that our solo patients feel comfortable.
Great. And then, Dr. Gupta, in terms of space, what should I do if I live in a smaller apartment or shared housing?
So we've had people store supplies in the church or a family member's house. As long as you are able to dialyze in the space you are living in, and you have an understanding that when you're doing the treatment or disconnecting, nobody will come in, you can treat. But we had a patient who was unfortunately, housing situation turned out not good, but he was on home hemo. So he went to his sister-in-law's house to dialyze. She was gracious enough to keep the supplies and everything in her house. So he would go in, and he was solo, so he would treat and then come to his smaller apartment where his kids was. So I think coming up with solutions and problems, yes, it can be done. It's just we have to get extra creative in those situations.
Thank you. And Emmett, you talked a little bit about what those first few months look like on home dialysis. How long does it take before it feels routine?
It just all depends up to you how well you embrace the process. Um, Again, there's so many codes that these machines have. As Dr. Gupta mentioned, we do have a cheat sheet that you could refer to and listen to. And eventually that starts to become memorized where you start to know all of these codes. But it just also depends on you. So the more that you could pay attention to it, even study it on your off time at dialysis, is one of the best things that I recommend doing, is what I did, and it works out for me very well.
Great, thanks, Emmett. And Dr. Gupta, how can I get on CKD? What are some of my options if I don't have secondary insurance?
So I think the primary insurance, and most of the time if you do home hemo, your clinic can apply for Medicare, and it starts from the first day of dialysis. So people can go on Medicare, and the clinic should be able to help you with all these uh, situations. Most of the clinics have a financial person or a social worker who's well versed with these forms and application.
Great, thank you.
And I think I was saying American Kidney Fund also, right, has some of these.
Yes, the American Kidney Fund, we have lots of financial assistance programs. So I would encourage folks to visit our website at kidneyfund.org to check out those programs. And then we also have a question here. In terms of figuring out peritoneal dialysis or home hemodialysis and which option is better for my lifestyle, what are some considerations? What are some things that I should consider?
So there is a thing, I mean, of course, talking to your team, finding the experts is the first step. And if you are not, so Home Dialysis Central has called something called Match D, MATCH Match D, which helps you decide lifestyle-wise if home dialysis and what dialysis will be work. It's kind of a questionnaire that you fill out, and that will be a good starting step if you want to do it yourself without any support from the medical team.
Wonderful. We have another question here. I'm currently on peritoneal dialysis. Would GLP-1 help? Any considerations there?
Yes, it's not been approved, but we do use it, and I have had good clinical experience on our patients. We don't take the patients off if they are on GLP-1s. It does help with sugars if you're diabetic specifically, or if you're trying to lose weight.
Okay, great. And then in terms of how far ahead you need to start training, what does that process look like for home dialysis, or how far ahead can I start training?
So most of the time, we start dialysis when the GFR is less than 15, but most people have different numbers where it start feeling symptoms. So it starts with symptoms, it starts with labs. And once symptoms are feeling nauseous, loss of appetite, weakness, mental slowing down, you just do not feel yourself. And I always tell patients that your family or friends will see the change in you more than you yourself. And that's when it's the time to start dialysis. And I think since it's a self-care therapy, and if you don't have a partner, you need to be in a situation that you can learn it to do it yourself. So I would recommend not to wait too long if you're especially starting from CKD. Like Emmett was an in-center, so he was feeling much better than when he started. But if you are starting directly from not being on dialysis to starting dialysis, and home is your first modality, it's more of a clinical judgment and your own self-awareness than there is an absolute number about it.
Okay, great. Thank you, Dr. Gupta. So before we close out, I'd like to ask Dr. Gupta and Emmett to share one thing they'd like our audience to know and one thing they'd like our audience to do based on today's session. So Emmett, we'll start with you. Any final thoughts?
Yeah, just, dialysis does not have to be a prison to you. A lot of people can do it 3 days a week and then feel that Tuesdays or, Thursdays or Sundays are just days of rest. I mean, in this day of age, we got to go out and enjoy our life. Find a way to make your dialysis work for you, not for it to tire you, and feel that you have not much to do. You can. If I can do home hemodialysis, up to 6 days a week, I was doing it, traveling around the country, taking my machine, getting things done the way I wanted to get it done. That tells me I'm empowered by this. I got a grip on my life, not dialysis having a grip on my life. So to me, that's something that I feel is such a big thing, to where I definitely felt empowered having this, throwing the basketball in my court and being able to do this. What I like for people to definitely take away is that home hemo may not be for everybody, but it is an option. And as we mentioned earlier before, check your resources in your neighborhood, in your nearby centers, if it's offered. Check the online classes if they're offered to you, and see if that's something you'd be interested in. It is always something that you can try and you can go back. So look into it, and don't be afraid to explore and embrace new things.
Great. Thank you, Emmett. Dr.
Thank you.
Gupta?
Yeah, the path to home dialysis begins with shared decision making, which is basically means your choice. And dialysis is a choice, and there are many options. Even though you see a lot of people going to clinic, but that there are other options. Keep asking questions. Keep anything that comes to your mind to make it more comfortable for you. Understand what are the important parts of journey. As Emmett said, it's your life. Understand your life goals and go with it.
That's right.
Thank you. Well, thank you again, Emmett and Dr. Gupta, for this engaging discussion. And thank you to the audience for joining us today for this session. So up next is our session on preparing for a kidney transplant from referral through the waitlist, which is at 12 p.m. Eastern Time. During the session, you'll learn what to expect before a transplant, from referral to the transplant waitlist, and how to best prepare so you can feel informed every step of the way. As we wrap up this session, you will see a brief survey pop up, so please take a few minutes to fill it out and tell us how we did. Your feedback will be very useful as we plan future sessions. Thank you, everyone, and have a great rest of your day.